Navigation 101 is important because as nurse navigators, we have a huge responsibility to ensure that this model is done to be patient-centered as well as meeting the outcomes of our patients and the institutions that we work in. Standard 3.1, which has been mandated as a patient-centered outcome and standard for patient navigation by the American College Commission on Cancer, specifies that all institutions and accredited cancer centers will have a patient navigation process. The importance of this particular session is that it will enable the nurses that attend to understand that it's not just having a nurse navigator in place, it's so much more than that. The nurses can be responsible for the process to ensure that the patient is safely guided through the entire cancer experience, from being out in the community, coming to the hospital, going through the hospital, and then back to the community with the resources that they need, as well as the barriers to care that have been identified. While the concept of patient navigation may have begun in the early 90s by Dr. Harold Freeman, oncology nurses have truly taken it to a whole new level. Now, with the mandate from the Commission on Cancer that we have Standard 3.1, the patient navigation process in place in accredited cancer centers, it allows oncology nurses to use their leadership skills, to develop programs, to develop processes that are patient-centered and truly do meet the patients where they are, identify their barriers to care, and then resolve them, having much better outcomes. Most important, that nurse navigators need to understand that they are the ambassadors for the future when it comes to helping to deliver patient-centered care.